We're going to move on to electrical hazards, and we're going to briefly talk about bloodborne pathogens. So I asked before if anybody worked around live electrical. When prepping for the presentation, I understood that there was some light bulbs that got changed. I'm not sure if you ever open up a breaker panel to see if a breaker's been tripped. But it's important to know what level of voltage those panels provide. Is it 240? Is it 480? Because if you open up those larger voltage panels and you're not properly trained, you're exposing yourself to a higher level of electrical danger. So electrical shock. How many of us have ever, middle of winter, you just get a static shock because you flip the switch on the light? Those can be pretty painful. You know, those can be pretty painful. So higher levels of shock, as I say before, you open that, in what I do, I see higher, 480 panels, even higher. The door's been opened, and there's breakers are missing. So there's potential opportunity to touch live voltage there. So higher levels of shock can cause basic, pain. As I said before, we've all experienced that static charge. Higher levels, loss of muscle control, body coordination, internal bleeding, nerve, muscle, and tissue damage, and potentially cardiac arrest if it is a high enough of a shock that can potentially lead to death. So as little as 50 milliamps, 1/3 the electricity needed to power a radio, can cause death in the optimal situation. So you making the full conduit of conduction, all the things in place. So it's important to remember that it's not something to play around with. It's not something to think casually about. So as I said before, at 1 milliamp, you will feel a shock. So that's those static shocks. They're right about 1 or 2 milliamps. You're going to feel it. 2 to 10, minor shock, might cause you to fall over. You see those in the movies, touch something and you jump back. 10 to 25, you can lose muscle control. You may not be able to let go of the current. So that's where you hear about people that become frozen because they can't let go. Their body has become locked. 25 to 75 can be very painful. It will lead to collapse, potentially death. 75 to 300 is almost always immediately fatal. So some fun things to talk about on a Monday morning. So we always want to make sure that you guys, understand what you should be doing and what is left for a qualified electrical worker. Qualified electrical workers are those that are permitted to work on exposed, energized equipment. So when you bring in your electrical contractors, they're qualified. They have the NFPA 70E training. They understand arc flash. They understand the hazards of that high voltage equipment. They know how to identify what's exposed and energized. Even me now as a safety professional, sometimes I'm in a large manufacturing facility. It's possible that some breakers are completely decommissioned. There's no power to them, but when I stand and look at it, it looks like a normal breaker box to me. So I'm not completely aware if there's power behind that or not. So I always leave it up to the electrical engineers. Tell me, is there juice here or not? I'm not going to touch that until I know. Qualified electrical workers know how to troubleshoot, so they know how to identify what's live and what's dead, and they know how to do it safely. So unqualified workers, those of you in this room, and that's a terrible way to describe you as unqualified, but I'm unqualified too because I am not an electrician. I know how electricity works, so I understand what it can do to me. I know the risks of working with something that's energized, and I know what tasks should be performed by those qualified workers. So in this situation, you're going to change a light bulb, but you're going to make sure you turn the power off before you do that because you're going to make sure that you're not leaving anything exposed in that light circuit. So electrical issues. If there is something that's malfunctioning, you should report it correctly. Don't try to fix it yourself. Make sure that you're having the right person correct it. Never open a live electrical panel. And I kind of, most people will say, I've opened the panel, stripped the breaker. If it's a 480 or even a higher panel, you could potentially put yourself at harm's way. Never touch or work near open electrical equipment. And you never reach into an electrical panel. So I say that jokingly. You always think about things that you would say, what person would ever do that? Because there are, if you look at a panel, there are areas where there's a knockout where you can then connect a cable to it, so there's like a circle. So sometimes those circles fall out. There's a hole in the side. Well, I always take a picture of that when I see that because I could walk over and put my fingers in there. Now everybody says to me, who would do that? Well, there's going to be somebody sometime that's going to stick their finger in there. I know it. So just put the cover back on so we don't have that hazard occur. And then obviously follow lockout, tag out. I don't think any of you are doing that work in this room. So finally, let's talk about bloodborne pathogens. That's always a fun topic for our custodial folks. So what are bloodborne pathogens? Viruses, bacteria, microorganisms, grossness, things that can be carried in blood. So, we call it bloodborne pathogens, but it's mostly, this conversation is protection against viruses. So unfortunately, you guys probably see a lot of vomit and mucus and all kinds of other fun stuff that potentially can come out of someone. So how do diseases spread? Well, 4 conditions. The pathogen has to be there, so it has to be present in order to be transmitted. There has to be enough of it to transmit the disease. You have to have a person that is susceptible to the pathogen, meaning you have to have the right entry point, and it needs to pass through the correct entry site. So how do pathogens enter your body? So I have the little picture of the doorknob there because I always go back to my 8-year-old, even when she was about 6, going into the public restrooms. Don't touch the walls. Don't touch the toilet. Don't touch. She would walk into the stall and she would want to touch everything. And I'm just like, oh my God, keep your hands to yourself. Don't touch. But direct contact, touching bodily fluids. So think about all the things, like if someone actually is injured and I cut myself and I spill blood here on the counter and you walk up and you touch it, well, there you go, direct contact. But the indirect contact are all those things that could potentially contain bodily fluids. So all those places in the bathrooms, hallways, even regular doors and whatnot, because again, if they didn't clean themselves properly when they left the restroom and then they've touched how many doorknobs along the way, they're transmitting everywhere they go. Airborne. So this isn't necessarily a bloodborne pathogen, but it's important to think about those things that are transmitted through coughing and sneezing. Tuberculosis, meningitis, the flu, all those things that run rampant through schools during different times of the year. And vector-borne, animal bites, insect bites, spiders and ticks and all those fun things that come out and can potentially get us. So you can become infected if that material, virus, comes in contact with broken skin. So when we talk about bloodborne pathogens, if your coworker, he gets cut and he splashes you in the face, well, you've been exposed through direct contact. A transfer into your mouth, eyes, or nose. So that's a direct face splash. If you are cut with anything that's contaminated that can pierce, puncture, or cut your skin. So we always talk about sharps. Everybody knows what a sharp container is, right? Where your needles go when you go to the doctor. But think about all the things that can cut you that might have blood on them. Piece of broken plastic, glass, wood, any of that. I do a lot of training, believe it or not. I do a lot of training for SEPTA. So we get into a whole bunch of stuff that could be sharp because think of all the things that happen in the train stations and all those things that can potentially be transmission points. So just to be mindful that what you're touching, you might want to protect yourself before picking it up with a bare hand. So bloodborne pathogens. When we talk about the diseases that cause concern, the reason why this standard is put into place, HIV, it's a bloodborne pathogen and we know it is a fatal disease. So it's important to protect yourself. The hepatitis viruses, they're all diseases that will affect your liver. They cause significant health issues, cirrhosis, cancer. They're really not curable. Hepatitis B has a vaccine, so if you're vaccinated for it, then you won't develop that disease. Hepatitis C, they're working on a medication protocol similar to what is in place. You know how people that have HIV, they can take a cocktail of medicine to keep the disease at bay. Same with hepatitis C, they're working on a drug cocktail to potentially eliminate the disease from the body. So those are all positive things, but if you come in contact with it, it will, you become infected. And the B and C viruses, just to throw that out, is hepatitis B and C can survive in dried blood on hard surfaces for up to 7 days. So even though it's dried up and you think, oh, I can just clean that up, it could potentially have a live hepatitis virus in it. So important to protect yourself. Clean up and safe housekeeping. If there is an accident, if someone's cut, entire area, or if it's not just blood, if it's vomit, if it's feces, whatever it might be, urine, the entire area must be cleaned with disinfectant. You need to make sure that you're disinfecting that whole area. All the equipment that you use, if it's not disposable, must be disinfected. Again, because if you're using a mop, that mop will be contaminated. So all that has to be cleaned up. So wear gloves. If you need to, wear safety glasses or goggles, if appropriate, if it's like that copious that you have to have additional preparation. So 1 part of bleach to 9 parts of water is a very effective disinfectant for viruses. What do you typically do when you have these types of...
We have a special chemical.
You have a special chemical. Yep.
We're not allowed to use bleach.
Okay. Yes, there are other Virex and some other approved Lysol brand disinfectants will work very effectively. We throw this in there because everybody, there's other companies that will say, oh, I can't afford to buy all that disinfectant. And I'm like, well, bleach and water takes care of it really well. So post-exposure, I don't know if you guys have any biohazard equipment. Office, awesome. Okay, so you know what you need to bag separately because anything that is contaminated is not classified as regular trash. You want to bag it, anything that's contaminated, clothing, PPE, if something got on your goggles, your gloves, all of that goes into the red bag. If anything is sharp, make sure it goes into a puncture-proof container. Do you guys have puncture-proof containers too for that? Okay. And then all of that is stored in a separate location. I'm assuming you have a storage area so that your third-party vendor then can come in and pick that up appropriately. Additional risks, repetitive motions. Things that you guys do on a regular basis that are going to, painting, forceful exertions, so pushing, a mop or scrubbing, awkward postures, you're bent over, you're doing things that put your body in odd positions, contact stress. How many of us get a blister on our hand after using a piece of equipment for a while? Vibrations, those floor sweepers vibrate a lot too, so having those vibrating tools. And repetition, shoveling, mopping and sweeping, breaking up ice, computer work, all those things where you're doing the same motion over and over again. All of these slides and the things that we talk about here is to just be mindful of them and make sure that you're taking logical breaks to give your body a break. So, shoveling, take a stand, stop, take a break for a few minutes, stretch your back so that you're not continually doing the same motion over and over again. Forceful exertions, you might have to lift something heavy, pushing machines and equipment, carts, things that might weigh, and then also the use of generally the use of tools. You can see the photo here. Look at the person's hands, the way they're pinched together. So once we put exertion on that grasp, there's a potential injury for the hand. If you're doing any outside work, you know, mulching, you guys talked about snow removal. I don't know if you're doing any grass care, but in general, cleaning floors, getting underneath a sink to do cleaning, general cleaning in general, all those areas that you have to put your body. Hoping that you guys don't have to get down on the ground too much like that guy is in that picture, but being mindful of. So what do we see here? They're using a straight ladder as an extension ladder. So, you know, they're.
I just see creative problem solving skills.
And then the poor woman, what is she coming up on? I never even thought of that one. That's a good one. Thanks. And here again, you know, we talk about ladders because there's so many, like why would you even do that? Like, why would you even do that? And here, you guys don't have any of these rolling belts in here, so that's good. But we understand how a rolling belt works. And what's this guy doing? He's leaning right over top of that rolling belt. He's going to get a shirt caught or whatever. Awkward posture here, running equipment. Could be a mop, it could be whatever, you know, but the position of the body is awkward. So in review, can't stress enough, use appropriate lifting techniques. It's very important. Make sure you're using PPE when you need it. And just in general, pay attention, take care of yourself. This video better work. Here we go. And then he drops her anyway.
Well, we get another video for this.
Ah, there you go. Because look, she's wearing flip-flops. I always think that one's fun. But no one ever catches that the boots that he shows her are pink. And now she's wearing yellow boots. So it's like, maybe the pink ones didn't fit and she had to put yellow ones on. So does anyone have any questions, comments, anything that I presented today? If not, make sure you've signed in the sign-in sheet. And I appreciate your time and thank you very much. Thank you.